there's a big difference between surgery and medicine. We all know that. I'm a medicine doctor. Prefer to be called an internist. We're the smart guys. The surgeons, they operate. But they fix people right away, they see results quickly, whereas medications, which is what I do all day long, take a long time to work, right? That's the old fashioned way of thinking about it. That's what many people think, but it doesn't really work that way anymore. Think about it. Yes, a surgery is very quick. You take out that, infected gallbladder, they feel better. Or do they? I don't think so, right? I could give medication and it works right away. You have a fast heart rate, give you some metoprolol, boom, your heart rate's normal, you feel better. Pretty sure that's faster than surgery, where you have to prepare for the surgery, get anesthesia involved, probably do a workup, right, to see if they have risk factors associated to go to surgery, unless it's emergent. You still have to take time to, scrub in, prepare, open it up, do all that stuff. And finally, you're done. And do they feel better? Well, not in PACU. After the surgery, they go to, post-surgical care places. Not in PACU. Where do they feel better? Afterwards? No, they're still groggy, and then the anesthesia wears off, and then they're in pain. So maybe the next day? Maybe the one after that, after they get over the post-op ileus? I mean, this is all joking, right? And I do agree, surgery, you take out that infected organ, oftentimes you save the person's life. No disagreement here. But the idea that surgery is faster is wrong. Medicine slower is wrong. But what's not correct, or what is still correct, from tradition passed on, old wives' knowledge, is surgery requires recovery, and medicine often does not. Let me give you an example from my personal life. So I have this finger. I don't know if you could tell, but it looks sort of funny. Not so many wrinkles here, a little bit red in here, awfully sort of, stiff, funny looking. It's because I had a splint for 2 weeks because I possibly had distal tendon injury to reduce the risk of mallet finger. And the thing is, after I took off the splint, the hand surgeon says, "You're good." I wasn't. My finger hurt, wouldn't bend as well as my other fingers. When I hit something, just even gently, it hurts. I know there's no fracture. I did this x-ray initially. But I'm not back to normal because I need to recover. I didn't even have surgery. I just had a splint for 2 weeks. Surgery takes time to recover. Medicine does not. And I feel that's one important distinction. So there's a lot of things that may make you realize this, right? Like, by common code, shall we say, apparently for the whole month afterwards, any complications are the surgeon's fault. They're probably not, right? But they are. That's just what this says. So, yeah, there we go. Surgeries have complications. Medicines also have complications, and they may take a long time to show up, and some surgery complications like, like removing somebody's gallbladder, you may have a bile leak afterwards and it may not show up right away. So the thing is, it's not to say that, different things have different delays or a lag period of side effects, but I think the main thing is really recovery. Surgery may be beneficial, but recovery takes time, and it's probably painful. It's not pain-free. Some go through it better than others, but you don't get back to normal right away. I think that's one big thing I realized talking to my surgeon friends. And that's one thing as a medicine doctor I don't understand. That surgery is risky. Surgery has complications. Surgery needs a recovery period. It's because they went inside, they mucked around, they did lots of stuff to your body that is not normal, that your body doesn't like, inflamed your body, shall we say, right? And now you expect things just to get better right away? No, it doesn't work like that. Your body takes time to heal. And when we say medicines are slow, they take a few half-lives, maybe a few days to ramp up their full dose effect. But surgery is just much slower. And I think that really helps me understand the surgeon's perspective. See, medicine, you're like, let me think about it. It's worth it. Sure, let's give it a shot, right? But surgeons really have to think about it because many of our patients in the hospital are older. They have lots of comorbidities, other medical issues, and recovery is not guaranteed. Recently, I had one patient, surgery went fine. It was prolonged, but it went fine. Well, the patient didn't do fine. Anesthesia, stress on the heart, all that stuff. Who knows what happened to her brain during surgery? CT, she became unresponsive later. CT didn't show anything, but doesn't mean her brain's not shot by something, right? There's a lot of risks to surgery. And that's something I'm beginning to appreciate more. I always learned, because I was trained well, that I don't tell people, patients, that I'm going to talk to so-and-so to do this procedure for you. No, I don't do the procedure. I don't do the surgery. I don't promise it because I can't. I'm going to ask Dr. So-and-so to come by and evaluate whether or not this be a worthwhile procedure or surgery. And I would double down saying that right now, because as a medicine doctor who doesn't do these things, who doesn't see the recovery and the bad outcomes, I simply don't know whether somebody should undergo surgery or not. I don't know the risk. Thus, I could tell you the potential benefit, but without knowing the risk, how can I say it's worth it? Recovery. Take some medications, some Keflex for infection, gets better, you're good, right? Maybe have some diarrhea, stop it, gets better. But man, recovery, the body takes time.